my name is Nicole, and I'm shooting this video with Tina. She is behind the camera right now, but she'll be with us shortly. Today we'll be discussing chronic renal failure with you, and we will be going over some of the testing that can be done to diagnose it and some of the treatments that can be done to help your pet if they are diagnosed with chronic renal failure. So chronic renal failure has to do with the kidneys, obviously, and the healthy kidney performs many functions, removing toxins from the blood and the body. And usually with chronic renal failure, we notice that the kidney just tends to kind of wear out, and that's what's causing the symptoms. Your pet may have any symptoms of any multitude, including excessive drinking of water, increased urination, lethargy, vomiting. Sometimes they'll have really foul breath, smelling breath. If they're not eating for more than a day, weakness, ataxia, where they're moving kind of uncoordinated, or weight loss or muscle wasting. So if you notice any of those symptoms, you should definitely bring your pet into the hospital. Chronic renal failure can occur in cats or dogs. Normally, we tend to see it a little bit more in our older feline patients, so that's what we will focus more on today. And some of the testing that can be done if you bring your pet in to the hospital and chronic renal failure is suspected, most likely the doctor will run a blood test. They will bring your pet into treatment, draw a blood sample. There are some tests that can be run immediately in-house. The BUN and creatinine are very good indicators of kidney function, or the blood can be sent out to an outside laboratory. It's also good to get, a full chemistry panel and CBC as well, just to get overall bodily functions. Then you will also want to get a urine sample. Usually that occurs through a cystocentesis. You'll send it off in a sterile urine tube, and they will test for the presence of bacteria. And also they'll test the specific gravity and if there's any protein in the urine. Protein loss in the urine can be indicative of kidney failure as well as a low specific gravity. You can also test the specific gravity in-house using the refractometer as well. So if your doctor runs all these tests and he does suspect chronic renal failure, we will go into the treatment of it. Most of it involves subcutaneous fluids and then some oral medications that we will discuss in greater detail with you.